A new meta-analysis review finds acetaminophen use during pregnancy does not cause autism, nor does it cause ADHD or intellectual disability. This comes after the FDA said last year there could be an association. So what should you do if you are pregnant? Well, we are fact-checking this for you. Dr. Nita Bijoor joins me now, a family doctor from Oakview Medical Associates here in Greenville. So thank you so much for being here
Thank you for having me.
I think as moms, I know when I was pregnant, you're just trying to do everything you can that's best for your baby.
Yes.
And you are cautious about things. So let's talk about this meta-analysis study. Can you first explain what that is and what was involved in this?
Yes, so in this article published in The Lancet, meta-analysis is a study of studies. So they look at a large number of studies altogether, and they're looking for large patterns in the studies that they look at. They look at extensive review of medical records. In this one, they looked at 43 high-quality systematic meta-analysis, as well as 17 big studies. That's like hundreds of thousands of pregnant women all over the world.
Okay, so that's a lot.
Yes, that's a lot. So it accounts for also confounding factors like family history, genetic, socioeconomic factors. They're looking at all different variables when they come to the conclusions.
And what was their conclusion?
So they found no association between Tylenol and the main three neurodevelopmental disorders they looked at. Number one, autism, attention deficit disorder, and intellectual disability.
Okay, and this is a little bit different from what was determined before. So let's first explain what is association versus what is causation.
So association is when a variable occurs along with another variable. So like, you know, I don't know, if you like ice cream and drowning, like people that eat ice cream, you know, in the summers, maybe there's an association with drowning seen in that time. But a causation is when something directly leads to something else. So association is a very weak way of identifying any risk factors.
All right. So I was looking into this a little bit more of what the FDA had released last year, and they pointed out two studies, a nurse study and a Boston study, and those found that there was an association with chronic use of acetaminophen. So what would you take away from that? I mean, is it you don't want to take this every day?
Yes, so I mean, think about who would be taking it every day in pregnancy. Using Tylenol or any medication chronically must be with consulting your physician, your gynecologist. So if you do that, then you know it should be under the guidance, and nobody should just take a medication, even if it's over the counter, without consulting your OBGYN. So there are other factors, maybe maternal health, maybe an infection at that point, maybe genetic factors, other risks. We need to look beyond just labeling it as one medication is causing it. And so Tylenol or acetaminophen is mainly used for fever and pain. So in those situations, we have so many other treatment options. You know, if we actually advise somebody in pregnancy to continuously take Tylenol, we have to have a very good reason to do that. We would usually advise physical therapy, hot and cold compresses, so many other ways, and identifying the cause of why Tylenol or why acetaminophen is needed. That's most important, you know.
It's my understanding usually you would advise it if they have a high fever, because that can impact the fetus.
Yes.
But if somebody doesn't want to take it when they have pain, let's say you have knee pain or hip pain, you have all sorts of things that can happen during pregnancy.
You ache in pregnancy.
How can you alleviate some of that pain naturally?
Yeah, so identifying the root cause of your pain, right? If it's knee pain, like is it because of the weight in pregnancy? There are braces you can wear. There's physical therapy, there's cold therapy, heat therapy, so many other ways. Physical therapy is a great tool. So identifying that and supporting the woman in pregnancy rather than just having her take one medication. Of course, it's always risk versus benefit. We're always looking at that, you know?
Yeah.
So,
but definitely in the case of a high fever, that's the case where we decide.
Yeah, and you got to, why is the pregnant woman having a fever? You need to identify the source of the fever, because maybe that's a variable that can lead to neurodevelopmental. We have to look at that. Like, are there conditions in pregnancy where there is fever?
And that could be the association.
And not taking acetaminophen can also have other risk factors. Like if you need something to control the fever and you don't, it's been associated with preterm births, you know, a lot of other complications as well. So.
All right. Well, thank you so much for coming in, breaking all of that down. I think this is a debate that a lot of pregnant mothers have, and they want to do what's best. So I think that was a good bit of information there.
Yes. Always consult your physician.